Hello, my name is Patrick DeMeo. I am a nursing program manager in the Department of Cancer Supportive Services here at the James. Today we're going to go over the use of injection therapy, ICI, for penile rehabilitation. This is the vial of Trimix that you are to keep in the freezer. When you keep it into the freezer, you're going to keep it in a plastic baggie. Once you take it out of the freezer, you need to wait at least 5 to 10 minutes before you're going to draw this up. Once you get the vial, you take the cap off, throw the cap away. Then with an alcohol pad, you're going to clean the top of it off every single time you inject. The opposite side, you can then use to clean the side of the penis off. Next step, it's very important. We need to draw up and inject air into the vial first before this vial works as a vacuum. If we do not inject air first into the vial, when you pull back, you're only going to get air and no medication, and nothing will happen. So this step is very important. So we pull back 5 more units of air than medication that we're going to be giving. We take the orange cap off, just lay this down. Here we go straight down in so that the needle is all the way into the vial. I then flip the vial upside down. Then what we do is we push air into the vial. How much air we put in and how much medication we're going to pull out. So we pull down to that volume. Now we are going to check for air bubbles. If you see an air bubble, it's usually right at the top or right at the bottom, and it would be noticeable. So if you do, you just flick this until the bubbles go up. Right? If you're flicking it and the air is still there, just push it all the way up, wait a few seconds, start all over. If there are no air bubbles, and most of the time there will not be, now you push up to the volume of medication that you will be given. At that time, just take the needle out, place this inside the cap. Then with the vial, you're going to put this back into the baggie. You can either put this back into the freezer now, or you can wait when you're done. Does not matter, but you do not want to leave this out all night long. Now we're going to go over technique. When we're injecting, we're not injecting at the top because those are where the nerves of the penis are. We're not injecting underneath because that's where the urethra is. Not at the head, not at the base, but mid-shaft range. Right? When we're injecting, we're going down at this angle like this, like at 10 o'clock and 2 o'clock on a watch. When we're injecting, if you inject on one side this time, you inject on the other side the other time. So you're alternating sides each time you inject. Very important, right? When what you're going to do is you're going to grab the head of the penis with your non-dominant hand. So if you're right-handed, you're going to grab it with your left hand. You're going to pinch the head of the penis. So your thumbnail is right in the center. We do not want this. We do not want that. Just like this. Then you're going to stretch out as far as you can go. As you stretch it, it thins the skin. It makes it easier to inject. In addition to that, it gives you a wider area to inject for you. We have veins in our penis. We do not want to hit the veins. So what you're going to do is you're going to turn the penis slightly at a 45-degree angle to the side that you're injecting on. So if you're injecting on your right side, you turn this way. If you're injecting on your left side, you turn this way. When you're injecting and you're turning, you're then drawing an imaginary rectangle in the middle part of the penis. Anywhere in that area where there's not a vein, you can inject. What some people do to make it easier, they put their finger like this, they turn and they can see exactly where they need to inject. That makes it easier for them. When we're injecting, we're not injecting underneath the penis, right? We have to go directly into the muscle part of the penis. Just like putting a nail into a stud, you have to hit the stud. So with this, you have to hit the muscle or else nothing will happen. Very important. When you're holding the needle, you're holding it like a pen or a dart, right? So not a cigarette. Cigarettes wobble. We do not want you to hold the plunger and inject like this or like this. We want you to go just like this. So at this time, before you inject, you're going to be wiping off the side of the penis, just like that. Then you're going to pick your needle up, grab like this and go straight down in. Once it's in, you're going to push the medication in. As soon as you take the needle out, you place the needle down. You're going to, with your entire hand, you're going to squeeze your entire penis and hold that for 2 minutes. Then you're going to massage around for another 2 to 3 minutes. When you're done with that, just stand up and walk around for a few minutes. The reason why we do that is because by squeezing, it traps the medication inside the penis. By massaging it around, it mixes throughout the entire penis, right? With the needle, when you're complete, you're going to put this into a plastic container in order to dispose of this. Once after those few minutes that you're done with this, then you're ready to go. Remember, when you're injecting, you have to alternate sides each time. That's very important to help prevent scar tissue buildup. If you have an erection that's still firm enough to penetrate at 2 hours, we want you then take 4 30-milligram tablets of Sudafed. If you have an erection that's still able to penetrate at the 4-hour mark, you have to get to your local emergency room. That is vitally important.